So we're naturally concerned that we've had a positive case in our community, and we've had over 10 Tier 2 sites in our community. So it's really an opportunity for everybody to come forward. If you've attended to those 2 Tier 2 sites, please come forward, get tested, isolate until you get clearance with a negative result.
There was a couple of really significant exposure sites like the Bunnings, all the supermarkets, quite popular areas. Is that a little bit concerning?
We would expect large numbers of our community to require testing, so that's why we've asked for support from our regional partners and from Metro Melbourne to help us set up more swabbing centres.
Sorry, is there a reason they're all Tier 2? Can you tell us about why there's not that high risk exposure for those?
Yeah, so what happens is the public health unit interview the person, they gather enough information and they do a risk assessment on what that person was doing, how long they were in that site, and then they assess whether it is a Tier 1 or Tier 2. So what you may find is an individual may have been contacted because they've had a direct and personal contact with that person, and they would be considered a Tier 1, but the site itself is considered Tier 2.
How many people were in the ED at the time, and can you just walk us through how it came to be identified, he was COVID positive, routine testing or symptoms?
So he attended the site and he was symptomatic, and the team absolutely treated him as a suspect COVID patient. They isolated him immediately and swabbed immediately. So we were well aware very quickly. We take a very conservative approach of any of our staff and our patients in that area, and we have asked them to isolate and swab just as an added precaution. But we were aware that this patient was suspect COVID and they were handled appropriately and safely.
How many staff members are isolating at the moment?
Approximately a dozen staff members are isolating at the moment and awaiting their test results.
Do you know the vaccination status of the case?
No, that's not information that I know.
And just with the staff, were there any other patients in the ED at the time, or was it just predominantly staff?
No, our ED is a very busy ED, so there was many patients in the ED. But what we do is that when we have a suspect COVID patient, we put them through a very special process where we put them in a separate area away from the patients. We do notify everybody who has been at the ED, once again, as an added precaution. So we don't believe there's been an interaction as such, but we're being really cautious to make sure everyone stays safe.
So I think it was Saturday the first exposure, and then it's been overnight Sunday he's presented to ED. Has he waited too long to get tested, or he hasn't been tested in that time?
That's a matter for the public health unit, but they actually interview people. So what we do find, and when there's a COVID positive case, they often take a very conservative approach going back 2 to 3 days to say where has that person been, and whether that person was symptomatic or not determines often that assessment of those sites. So they've obviously been out and about in our community, and that's what's determined those Tier 2 sites. Case in our community, so it's really important that we stay alert. We are asking a large amount of our community to get tested who have been to those sites. What's really important is if you experience any of the symptoms, we also ask you to come forward. COVID could be in our community. We need to be alert, and I need everyone in Wangaratta to respond appropriately.
Robyn, you now have the 2 testing sites. Do you anticipate that the new showground site will have the same testing capacity as Tone Road, and do you anticipate any more being needed in the coming days?
We would expect that we will have 2 lanes running at the showground, so it will have as great a capacity as Tone Road as well. And we are preparing for the possibility that we may need more sites in the future.
Is the hospital preparing for taking in more cases? Is it set up to accommodate?
Yeah. So the hospital has been preparing for a COVID outbreak for approximately 18 months. What we have done more recently is that Delta is very different, and we expect to see a lot more cases in our community, and what we have learnt from neighbouring outbreaks is that it has a significant impact on our staff. We have prepared for that, we are ready for that. We will continue to offer our acute services.
And speaking of impact on staff, just with the ED, those dozen staff sort of isolating at the moment, is that putting extra pressure on the ED at the moment?
Any staff shortages impacts our organisation, but what we do have is great support from our staff, and they are redeploying so we continue to maintain our acute health services.
Is the hospital preparing to scale up even more once we open up the state, to scale up to be able to take more patients as the cases inevitably grow?
Yeah, so we are preparing for opening up. What we do know in Wangaratta is we have an excellent vaccination rate. We have over 82% of our community who have had their first dose, and we see that in the next 6 weeks we'll have that will be 82% who have had their second dose. So we feel quite reassured about that our risk level is possibly a lot lower than some of our metro friends. But we are preparing. We would expect that we will see more cases, and we are very concerned about those in the community who are not vaccinated.
And can we, just for absolute clarity, because there is 2 sort of cases involved in the exposure sites, all 10 added yesterday are due to this latest case?
Yes.
Yeah. And can you just walk us through how your contribution works with the public health unit based through Wangaratta Health?
Yeah. So if we had a positive case, so our process that we contact the local public health unit, which is Wangaratta Health. They have the responsibility to conduct all those interviews, do that risk assessment and determine those exposure sites. Here at Wangaratta, my focus is in delivering the healthcare services our community needs and to run the drive-through clinic and the vaccination hub. Those services are continuing.